Hi Dave,
Hi there, how are we going?
this is Dave Harrison, who I've decided to introduce you to because he's the producer of the Allergy Power Spray that you may have read about, or you may have seen the testimonial that Jennifer did, who had used the product. So I just thought I'll ask Dave to give you, the general public, a little bit of background on the allergy spray. So here's Dave.
Yes, allergy spray is a preparation that we produced as a broad spectrum preparation to help with broad reactions in the body, reactions from the respiratory system, such as acute rhinitis, through to respiratory distress symptoms, asthma, etc., through to skin conditions such as eczema, psoriasis, excellent for the herpes. Um, uh, Lesions and symptoms of herpes. Excellent as far as shingles are concerned, particularly used in conjunction with something like amber cream, which we also manufacture. Um, this preparation contains a good sound spectrum of alterative herbs such as burdock, nettles. And we also have, unique to this product, a New Zealand native called kumaraho, and that is, if you like, one of the major herbs, native herbs of New Zealand that work as a good solid alterative that helps to alter the body's chemistry to one of normality. And when you have a reaction taking place, part of the response that we want to produce is normalising the body's chemistry, where there's a lot of histamine being released and that sort of thing. We need to try and reduce the sensitivity towards irritants, which lead to histamine um, release in the body. To complement those herbs, we also have a range of homeopathic preparations, and the homeopathics in there give us a much greater dimension to the therapeutics of the product. And if you look at homeopathy, if those that understand it, like cures like, and we have herbs in here such as apis, which is a specific for helping with swellings of joints or swellings of soft tissue from knocks and that type of thing. So you'd find that sort of thing in arthritic conditions where there's a lot of fluid retention or swelling up in the body. Just general edema would also be affected by this preparation as well. Histamine, we have homeopathic histamine in there that works as an antihistamine, if you like. And in the likes of the rustox, specifically useful for, like I said, those skin conditions such as the herpes. And when you combine that with the Urtica homeopathic, then that deals with a lot of the eczema type symptoms, rashes, that type of thing, particularly where there's a prickly heat sensation associated with it, and if there's nerve irritation or nerve pain. Those are sort of things where you would find it particularly useful.
Can I just ask you, Dave, just quickly? Can you just spend a minute just chatting about safety of using this product, and is it different for children or animals, or is it the same, or how does that work?
There's really a two-pronged approach for the dosage system of this type of preparation. Firstly, when you're trying to obtain a, if you like, a result from a chronic or long-standing condition, you would tend to rely a lot more on some of the herbal components and the alterative influence that they have to desensitize the body. And the dosage system there would be one of a larger amount, such as 3 sprays 3 times a day, um, on an ongoing basis. Whereby, if you want to use if you have an acute situation and you want to use the homeopathic influence more so, then you would use maybe 1 or up to 2 sprays, but on a frequent basis, i.e. every 15-20 minutes, for maybe 3 or 4 doses, and then give that a bit of a break over the day and see how you respond to that.
So would it matter if somebody, like took a spray every 5 minutes? Would it? Would
No,
that?
there's the level of toxicity is very, very low. Obviously, there's potentially always somebody that may respond to some herb or some chemical. So the first spray probably should be done with a little bit of caution, just to check with reactions. But all in all, this is a very safe preparation, and I would not expect anybody to have an adverse reaction to this preparation used under the guidelines that we've recommended.
Oh, thank you, Dave. That's very helpful, and I'm sure perhaps I might be able to twist your arm to do a few more of these little interviews as we post products on the web. So thank you, Dave.
Cheers. All the best.